Welcome back, our dear viewers. Did you know that every year millions of people, from professional athletes to everyday desk workers, face injuries, pain, and physical challenges? The question is, how do we recover, rebuild strength, and prevent those injuries from coming back? That's where physical therapy plays a vital role, not only helping patients heal, but also teaching them how to move smarter and live stronger in the high-stakes world of sports. Sports medicine goes even further, combining science, technology, and care to keep athletes at the top of their game, while protecting their long-term health from common spiraling to cutting-edge treatments, from prevention to peak performance. These fields are shaping the future of how we move and perform. Today, we'll explore the breakthroughs, the challenges, and the inspiring stories behind physical therapy and sport medicine, and why they matter to all of us, whether you are an athlete, a patient, or simply someone who wants to stay active and healthy. So we are pleased to have with us today Dr. Jawad Abulhasan, physical therapy doctor. Welcome to the show.
Thank you for having me here today, and hopefully we can provide an insightful information for our dear viewers.
Inshallah, of course. They say if you are a physical therapy, you don't need to go to the gym because all your work is exercise. Is that true?
Yes, our work consists of a lot of exercises and moving around, but also you need to go to the gym to have a proper workout to meet your daily requirements in terms of number of steps, strength training. So still at the gym you can help the patient and you can demonstrate to the patient, but still you are not doing the full set. So yes, we do need to go to the gym also.
That's really awesome. So that was one of the misconceptions that people have, that if you are physical therapy, you don't need to go to the gym. And talk about misconceptions. I know there's a lot regarding physical therapy. One of them that people think is a massage. So you could tell us more about some of the misconceptions.
Definitely. Physical therapy is far beyond just one single skill of treatment. It contains doing some exercises, utilizing the new technology, providing some psychological needs and help, trying to make sure the patient is fully covered in terms of his pain that can go beyond his physical capacity. Problem. So yeah, it contains a lot of other things, not just a massage. Another misconception is that people think physical therapy can get a quick result. It's
like a one-day fix.
Yeah, which is not correct, because in physical therapy we learned how to go dig deep and treat the underlying cause. So if you want to do that, you need to have a proper program, proper guidelines, and to have some time so that the muscles, because we work mostly on muscles and joints, to make sure that people are living healthy, moving around free of pain. So we need to give time to the joint and muscles to heal and to recover. So it's not a quick fix. That's the second misconception.
Of course, and some people might think like if they come, it's like only about diagnosing the injury. But I know there's something behind diagnosing the injury. Like there's a lot of process going through.
Yeah, true. Usually, the patient needs to be checked as a human body.
Yes.
So you don't only fix the joint itself. You need to see the patient as a holistic approach. You check with his stress level. You check with his daily life routine. You ask about his happiness, his hours of sleep, hours of activities. You need to check everything. You have to take all the history of his daily activities. And including the injury itself. So it's not just one single factor. It's a multifactorial factors, and you need to see the patient with all the different angles, not just one angle.
One angle, of course. And talking about holistic approach and also like daily routines, I know right now the weather is getting better. A lot of people are running, jogging, riding bicycle. So what are some common injuries that you usually check at the clinic?
If we want to address two problems. We can start with the back pain. So people are suffering from back pain a lot. There's a statistics, a study conducted and a surveillance showing that 80% of the population in the world once in their life will have a back pain. So it's a huge percentage, 80%. So yeah, back pain is one of them. The second problem is knee joint. The knee joint problem, because everybody walks and everybody try to move around. So the knee joint is under a huge demand. So if
a lot of stress on it.
If you don't take care of that joint, you'll get a lot of discomfort, pain. So we need to make sure people can work out alone, walk as long as they want, pain-free, without
so they can live like a happy life.
So mostly we see those kinds, and of course a lot of other problems, but those are the most common too, at least in our clinic.
That's really awesome. And how important is rehabilitation after an injury? And how soon should the patient take the rehabilitation program?
Yeah, it is very important because after any injury, there is a lot of things happens inside the body in terms of the joint flexibility, in terms of the strength of the muscles. So after any injury, every patient should go in a full rehabilitation protocol, so we can figure out the deficit and we work on that. Then we go to the next step where he can, if he's an athlete, how he can go back to his sport, how he can play football if he's a footballer, or if he's an just recreation exercisers, how he can, and when he is ready to have the green light to go back to the gym, if he's an athlete just working out for a healthy lifestyle. So yes, after every injury, there should be a rehabilitation.
So he can be in a good condition to perform.
Tailored to his needs.
That's really awesome.
Yeah.
And when we talk about rehabilitation, one important ingredient is nutrition.
Yes, sure.
And also a recovery.
Of course.
So does the recovery different from, or differentiate from a regular person to someone who's an athlete?
Yeah, of course, because athletes have high demand, so they run more than normal people. For sure, they lift weights more than recreational exercises.
And the weather is nice. They go for marathons and run 5K, 10K.
Some of them runs a lot. They cover 70 kilometers per week. So their muscles and joint need some refueling in terms of proteins, number of grams in terms of carbs, sugar. They need to refuel after what they have lost during their exercise. So, for example, if an recreational footballer plays a 60-minute football game, they will lose, let's say, 400 calories. On the other hand, if a marathoner runs for, let's say, 20 kilometers, they will lose more than 1,000 calories. So
double the
you
amount.
need to refuel those deficits, 1,000 calories you lost during your 20 kilometer running. So yeah, it is a different scenario between normal athletes and high elite athletes who run, for example, a marathon.
That's really good to know. And I know we talk about the injuries for regular people or in general, but for athletes, what are the most common injuries that you see in your clinic?
For athletes, we usually see muscle-related injuries. Since they are trained, but sometimes they overtrain.
So lack of recovery.
Lack of recovery, lack of sleep, lack of nutrition, and the high demand of their sport, their muscles get torn or get overstretched, or they suffer from muscle strain. So athletes suffer from muscle problems the most, I think. So yeah.
That's really good to know. And I know we talk about diagnosis in terms of understanding the background of the person himself. Yeah. But today technology is everywhere. Did technology change the design of diagnosis?
Yeah, of course. That's a great question because as you know, nowadays technology is enhancing. So people are using their, for example, the watches, the wearables, so they can get more insight into their program, into their workout. They count their number of steps, number of
calories,
stress, number of calories. So all those data is helping already their recovery, their performance. So the technology is booming now. It's widespreading in everywhere, and people are starting to utilize it already by, for example, as we said, the wearables, the watches, and etc. So the technology is great things you can utilize in your daily activity, and nowadays it's not that expensive compared to 20 years back. It's affordable. You can have different kind of wearable, different kind of brands that can suit your budget. So yeah, I suggest and I highly recommend anybody to have and utilize that technology and buy any kind of wearables. So we have a data that we gather every day or every week, and then we compare before injury, after injury. You have a data set that you can rely on.
And that also can help you, like as a physician and like someone expert. They can also bring some of minimal data.
Of course, yeah. That's why I highly recommend, because when a patient comes to me that already have a set of data that I can utilize, I can analyze, then I rely and base my rehab on those data we already knew before
That's
he
really
got
awesome.
injured. Yeah, so it's an objective rehabilitation based on his personalized data. So that's why we can have a better performance later on. We can make the rehabilitation as short as possible, tailored and individualized to that person based on his data. So that's why we're already in our clinic utilizing those kind of data sets.
That's really cool. So
Yeah.
next time, our dear viewers, if you want to go for a jog or running, make sure you charge your wearable. If you don't have one, this is a good time to get one.
Exactly, yeah. And yeah, enjoy for the reason why we do that, just for having fun, enjoying their time, building some strength, building some quality of life.
Exactly.
Because if you want to go to the gym, you'll get a lot of benefits. One of them is to change your mood, to have a
better health life. Yes.
Yeah, in your day, and overall a better life, injury free, or reducing the risks of injury. So yeah, it's a plethora of advantages. So why not utilize them and start working out, even just 10 minutes of walking to start.
Exactly, that's really
good
golden tips from Dr. Jawad Abulhasan. And regarding like quality of time,
Yeah.
and also like living healthier, one thing that could help is nutrition. So how can nutrition help us to prevent injuries?
Of course, nutrition will support us. We work as a holistic team, physical therapists, nutritionists, surgeons, doctors. In terms of the nutrition, we have a lot of collaborations where nutritionists will support us, will support our need. The athlete or the patient will go visit him and see his overall calorie intake, overall consumptions daily, and he design, because the muscles need some protein. The protein is like a fuel.
Exactly.
To the muscles. If you work out a lot, then you need to refuel. So you need to have an adequate amount of protein in terms of grams based on your body weight. So it is very important. On the other hand, liquids and water, you need to digest a lot of, because especially here in Kuwait, when it's hot weather, we sweat a lot, so we lose a lot of
to prevent dehydration.
So we need to rehydrate our body. Nutritionists can help us, of course, and support us in terms of guiding the patient into his success and into his enhancing the performance. So yeah, it's a teamwork consisting of a lot of healthcare providers, all working together to help our patient and our athletes at the same time to achieve their goals.
Of course, and I think our dear viewers, after now, you have learned that physical therapy is not only a massage or something like related to massage. It's more than that. It's beyond that. It's something essential in our everyday life interactions, from sitting to the desk, from approaching our work, and even running or practicing any sport activity. Thank you so much, Dr. Jawad Abulhasan, physical therapy physician, for being with us and enlightening about this beautiful concept that regarding physical therapy.
Yeah, my pleasure, and again, thanks for having me today again, and hopefully we gave some insight to our dear viewers to learn from those kind of tips.
Of course, thank you so much. And now, our dear viewers, we're going to take a quick break, and then we're going to be back. Stay tuned.